on the agenda, I have a special someone in the room. Do you want to guess who it is? Any guesses? You know. Oh, no, it's not okay. So, but before I introduce her, I would like to read highlights about her and her career. So, she is the Chief Nursing Officer in the Department of Health, Ireland. She has been in the post since June 2020. She was formerly the Deputy Chief Nursing Officer, leading on nursing and midwifery policy for patient systems, safety and governance. She's a registered children's and general nurse, and while she specialized in pediatric critical care initially, she has extensive clinical and managerial experience spanning 30 years in Ireland and in the United Kingdom across a wide variety of clinical areas. So we are welcome the wonderful, amazing Kenna.
Good morning, and thank you for that amazing welcome. I really am delighted to be here with you this morning and to get the opportunity to meet you, to be with you at this special event, and to talk to you a little bit about what I do and how it's relevant to you, because I can only be successful as a policymaker if I have collaborations right across the board, not just across the department, but across the health system and across the world. So my connections with you are really, really important. I want to begin by acknowledging the organisers of today's summit, a really, truly fantastic event. And I've met many of you on visits out to healthcare settings in the Department of Health and at various conferences. So I know your contributions are so significant, and I really want you to try to tell you what we're doing in the Department of Health so that you can continue to engage and work with us to make sure that we get policy right, because policy has a fundamental platform for making sure our work environments are good, for making sure that our patients are getting what they need, for making sure that we enjoy our jobs and that we have great career opportunities. So the summit presents an excellent opportunity, and for everybody that has travelled here today, to have open dialogue, new learnings, to create new connections and maintain key partnerships, which is a really, really important part of what we all do. As the Chief Nursing Officer in Ireland, I have a huge amount of work to do with an amazing team on nursing and midwifery policy. But I also have the opportunity to work with, influence, develop and be part of health policy in a broader sense. I have policy responsibility not just for nursing and midwifery workforce, but for medical workforce, for health and social care professional workforce, and for all workforce across the health system from a policy perspective. I also have a responsibility for patient safety. Now those are not disconnected, they are very connected in the context of policy. So in that whole context, we share many common values with the African nations. We have a very similar commitment to providing quality to patients for care for the jobs that we do. We have a belief in equitable access to services, and we have an understanding that people are at the heart of healthcare delivery, no matter what we do, each of us. Solutions to healthcare challenges cannot be developed in isolation. It is through events such as this where we can collaborate, listen, and have a shared commitment to building a health system that is sustainable, equitable, culturally responsive, and ready for the future, is what we're all about. The theme of this year's summit, Leading the Future of Healthcare Across Borders, could not be more timely. Congratulations to the organisers on having such a relevant theme for today's conference and summit. We meet at an extraordinary time of global health change. Internationally, health systems are grappling with workforce shortages, with conflict, with rising demand, with demographic shifts, with accelerating pace of innovation, and in the recent weeks we can see the devastating impact that heat is having, particularly across our European neighbours. But we also have a great opportunity, an opportunity to reshape how we work, how we lead, and how we provide care. And that's where policy comes into play. Ireland is no exception. We are evolving at a fast pace, and internationally educated healthcare professionals, many of whom come from African nations, are essential to that evolution. All professionals are valued as members of our healthcare workforce, and of course of our society. And we are strengthening work teams through international experience, be it clinical, linguistical, cultural expertise that enhances care for everybody, enhances work environments, and really is reflective of our multinational population in Ireland now. And I think the fact that we have become so integrated with an international workforce has really kept us at the forefront of change and of innovation and being able to respond to need. Ireland's health system has always been shaped by migration. Much of it about Irish nurses and doctors leaving Ireland. But in recent years, in recent decades, it's more about having that diversity in our workforce, being a country of destination where people want to come and work, where we have developed good integration across borders. Thousands of nurses, midwives, doctors, healthcare assistants, allied health professionals from African countries are working across our hospitals, our community services, our mental health teams, our maternity units, and our primary care networks. And many of you bring perspectives shaped by different health systems, learning about different cultures that we wouldn't have had here in Ireland decades ago, different ways of understanding health and patient needs and patient care. The diversity of opinions that I meet and hear in my daily work, the expertise that I see that's demonstrated, and a culture that must be recognised as being a significant asset to our healthcare workforce. Our patients are benefiting significantly from the diversity that we have today in our workforce, and policy needs that to capitalise on actually achieving better and more in touch patient care. Diversity, however, must be matched by a system that supports integration, equitable treatment, sustainability, and leadership from within. So we want internationally educated professionals to thrive in our system, and we must therefore design systems that support from the moment that international professionals, colleagues arrive in Ireland. And what we need to do is do that together. Your voices, your contributions, your input is essential for us to get that right. We need clear pathways to registration and recognition of qualifications, and we've done a huge amount of work for that, but there's work to do. I've met many of you at regulation conferences this year, and I've listened to the challenges that you do have, and we are working together to try and make that better. Equally, we need to provide career pathways. I've met many of African nurses in particular, and midwives when I've been out and about, who are now in promotional posts and are really impacting through leadership on bringing that diversity and integration around what we can and need to do. We also have to accompany these leadership opportunities, career development opportunities, to advanced and specialist practice by proper mentorship and peer networks, because otherwise we don't want people to go into what are very difficult jobs and not feel supported. And finally, we do need co-created anti-racism policies and reporting mechanisms that are clear, that are robust, and that are trusted, and they must be systematically implemented across our health system. Integration is a continuous process, and we need to continually support and learn from each other, because the benefits to our healthcare staff and ultimately our patients are immeasurable. Integration also means a shift towards culturally responsive care that recognises that health is shaped by culture, identity, history, and lived experience of all of us. The shift requires us to challenge assumptions, to confront our own biases, and to create environments where every staff member and every patient feels seen, feels heard, and feels respected. From my perspective then, workforce sustainability is another real challenge, and we are facing it both nationally and globally. And from a policy area, we can't just look at the Irish workforce. We have to look at the European workforce and us as part of that, and then we also have to look at the global workforce and Ireland. Albeit that we're a small country, we're a very important part of the global health workforce. Sustainability begins with a strategic workforce planning that looks beyond immediate pressures and anticipates the demographic, social, clinical, and not just the short term, but but the longer term future as well. At the heart of this in Ireland is the framework for safe nurse staffing and skill mix. This framework has been developed on a phased basis, and it's a very good example of how policy in action can support staff, can support patients, and does deliver better work environments. A key part of this innovation is the digital layer, the digital aspect to it. TrendCare, the IT system that measures patient acuity and dependency in real time, is now fully live in 15 of our hospitals across the country. We are going to have it in all 49 of our hospitals by the end of this year. Why is that important? Because it's giving clinicians real-time data on what they need to do to make smarter staffing decisions, to make smarter care decisions, and that it is really focused on patient need. In 2026, this is a milestone year for us to have that ability for healthcare professionals, not just nurses and midwives, because it will impact all of us working together. Sustainability also means prioritising staff well-being, and this is a core element of the safe staffing framework. A sustainable workforce is one where staff feel valued, protected and supported. And part of what we do is having safe staffing is allowing people to do their jobs well. It's not just keeping them in the workplace to do the job, it's allowing them to do that well. What does that mean? That means that you're part of the team, that you're listened to, that you're heard, that you have time for training and education, that you have time for reflection, and that you have time together as a team to deal with the many challenges that you face on a day. We participated in the WHO Mental Health of Nurses and Doctors MEND survey. This is a really important piece of research that was done across the European region in terms of the mental health and well-being of our workforce. And it gave us some really valuable insights that we have to pay attention to. What we did see is that the rising demand, the increasing complexity that people are working with right across the health system, and the workforce pressures which translate directly into sustained pressure on workforce needs to be a priority for every country. There's no single policy solution, we did see that, but workforce mental health challenges, and addressing it means that you have to look at a coordinated, multi-level response across policy, education, safe staffing, and the health system responsiveness in totality. It means that you have to be open to innovation to make workplaces better, and that we have to be responsive to what people are saying to us, what the workforce are demonstrating for us. Because the environments are not going to get less complex, in fact, they're going to get more complex. So we have to be ready to move with that. And from where I am since 2020 in the policy world, that is done through collaboration, working with people, summits like today, to be able to listen here to the very real challenges that are out there. This information, this feedback is gold dust for policymakers because it does inform what we need to do. It does also require supportive leadership that normalises staff seeking help and support when they need to. And we've got to encourage and support our leaders to have time to do that. And that's very difficult. Having spent 30 years on the front line, I know what it's like to be in a demanding work environment. So these considerations in terms of what we're doing in the Department of Health for workforce planning, in December last year, if you haven't seen it, the Minister for Health published Ireland's Future Health and Social Care Workforce Plan from a policy perspective. It talks about how we need to plan better because we have a significant reliance on international workforce, as you will all know. That's not going to change. That's not our policy. We want to keep that diversity. We have benefited hugely, and that's going to be our policy going forward. We are building more training places for our own training places here in Ireland. We have to do that to become domestically stable. But again, we have such an international community in Ireland that that is actually going to benefit us hugely as well. We're going to continue to build our workforce. We're going to invest significantly in our workforce over the next 10 years to make sure that we have a much more sustainable workforce to rely on right across the health sector. We're going to optimise performance. We're going to do that through advanced roles. We're going to do that to make sure that professionals can work at the top of their licence. And we're also going to do that through innovation and technology and leverage what we can out of that to make our jobs easier, to make our environments more dynamic, and to actually impact patients as far away from the hospital as we possibly can. That is the policy direction. staunch care. So we're going to see new roles in community, we're going to see new roles working with people in their own homes when they're actually quite unwell. And this is going to be done through innovation, through technology, and through really integrated leadership right across the system, with clinicians working together. This means an emphasis on improving work environments, supporting work-life balance for people, understanding and expanding career progression in the necessary ways, and tailoring approaches across to different professions working together at different life stages of care that is required. We will aim to retain staff by making them feel valued, and we have to continue to work on that, and provide opportunities for personal and professional development as you move through your careers. These pillars cannot be implemented in a vacuum, we're very aware of that, and as I said before, leadership from within is going to be critical to our workforce and our survival in terms of the policy, because our policy is actually quite ambitious. We're recognised globally for the work that we're doing on our workforce, for the integration approach that we have taken, and for the diversity that we are showing in terms of delivering patient care. But leaders are actually the engines that are going to drive that inclusive, future-ready workforce system, and they determine whether innovation and equity become part of our normal day. They determine whether the realities of policy are going to be made possible, or whether they're going to stay in the aspirational box. We can do all of the shiny policies that you want. We can write fabulously evidence-based policy, we can give clear direction, but unless we have the support, the ability to implement policy, none of it will work. None of it will be as important as we think it is. And it takes so much input to develop policy that it's a shame if we don't actually embrace the opportunity that we have. Before I finish up, what I would really like to, I hope that you've got a sense of where we're going with that, but another really key area that we're focusing on is virtual care, technology-enabled care, and this has to be driven. This is one way that all clinicians can embrace innovation in a safe and supported way. There's lots happening in legislation in Ireland, there's lots happening in policy, there's lots of supports in place. But what we really need is that innovative clinical thinking, that partnership that's going to bring the reality for patients into focus and work with us. We're going to create opportunities for nurses, for pharmacists, for health and social care professionals right across the system to be able to come up with ideas. We've got the Spark program already, but in workplaces we're going to have leaders who are going to have to be able to enable this through clinicians and support virtual initiatives for patients and technology-enabled care for patients with that leadership. We've got advanced practice, not just for nurses and midwives, very well established in Ireland and working very well for nurses and midwives over the last 10 years. We've now got it for health and social care professionals. This is where a real partnership comes into play, where we've got opportunities for clinicians to take leadership right out to the point of the patient in an advanced practice way, working to the top of that fabulous training that everybody has. This is really, really important, and if you're not getting the opportunity to do so, I suggest you seek your managers out and say to them, why can't we do this? You have all the ideas, and we should have the leadership and capability in the system now to enable that. I want to leave you with a final thought. The future of our healthcare system will not be determined by budgets, although it seems to be the focus of every conversation. New technologies are national policies. All of that, as I said, we can have as much of it as we want. The important supports and the key drivers of any reform is you. It's us, is you, working together. Encouraging and supporting the workforce to embrace innovation, to invest in the workforce sustainability, that's our job, to drive the money towards where we need it to be. In order to do that, we need to engage with yourselves, we need to hear your stories, we need to hear your ideas, and we need to hear your experience. I really do wish you every success with your conference, a fantastic theme, fantastic speakers, and a great lineup. Thank you for your leadership, and thank you for the extraordinary contribution you make every single day to our health system. We're really in love with.